Welcome to this West Midlands School of Clinical Hypnotherapy revision video. Today we're going to be looking at hypnotic language style. Specifically, we're going to be looking at the polar opposites of the authoritarian approach and the permissive approach. So let's start with the authoritarian. The authoritarian is very much the traditional approach to hypnosis. Suggestions are clear, they are direct, they're usually quite concise. It's characterized by such language as you will, you shall, possibly even always, and historically, and I must emphasize this is historic, suggestions for sleep. So your classic deep asleep suggestion is pretty much seen as a classic authoritarian suggestion. However, some of the other sleep suggestions, tired and drowsy, are more there by tradition than anything else, and they're perfectly valid to be in the other camp, the permissive camp. So let's look at the other end of the scale, the permissive suggestions. These come to us predominantly from the Ericksonian school of hypnosis. Permissive suggestions are characterized by the perception of choice, what I like to characterize as choice and possibilities. So you're not pinned down to a single thing. A suggestion will often be in the form of a question. An I wonder if type question, or I wonder which will be first. They're usually still directive because they're narrowing your attention in a certain way, but they're much more open, much more fluid in their delivery, tend to be a lot gentler in their delivery. So characterized by words such as perhaps, maybe, I wonder, and relax. And these different types of suggestions, they do different jobs. One is not better than the other in any way. It's just about appropriateness to the individual client or patient you're working with. So, for example, the authoritarian, it's clear, it's concise, it's probably better for people who think in those type of ways. So classically, the example that will be given is it's good for people who are used to giving and receiving instructions and orders. So police, fire, services, military, and I probably should emphasize it doesn't necessarily mean you're barking orders like a sergeant major. You're just giving clear, concise instructions in the way that they are used to receiving instructions. So you're paralleling their own way, and the best way of telling whether they're authoritarian and appropriate is the delivery of the person. It always really comes back to the patient, and if they're if they're talking in clear, concise ways, you'll probably want to reflect that back by doing a more authoritarian induction or deepener, even though you might soften it off later. Now, the permissive is basically good for everyone else. The little bit of research we have on this, and it is a very little bit of research, but the little bit of research we have on this suggests the majority of people prefer permissive. In fact, most people prefer permissive, but older men seem to prefer authoritarian. That's what the research suggests, but I can't emphasize it's a very small body of research. But the permissive, we give nice and gentle, weaving suggestions, might be a good way of putting it, with perception of choice. And this is good for the majority of people, particularly in a therapy environment. I mean, if you're working with somebody who's presenting with an anxiety problem, sexual problem, whatever it might be, the chances are they're going to respond better to a gentle, soft induction, because it's not going to give them anything to fear. It's going to give them the perception of choice. They're going to keep that perception of control. So as a starting point, permissive is probably where you should begin, but look out for those opportunities to use authoritarian appropriately, because when you do, it can be very powerful. And quite often you will find in books and texts that one will be presented as authoritarian and one will be presented as permissive, but often the underlying ideas behind an induction, let's say, can be made more or less authoritarian, more or less permissive, as you see fit. And that comes with practice, it comes with skill. But it's relatively easy to do. Okay, thank you very much.